Good evening, everyone. Tim Richmond with the Wapello County Emergency Management Agency. We all gathered here tonight to bring you up to speed on some activities that we're doing for you. We are in the midst of a world event that is having a direct effect on our county and the lives of our citizens. Late last year, a coronavirus known as COVID-19 began infecting people around the world. Recently, we have begun to see cases here in Iowa. While there are no current cases in Wapello County, there is confirmation in the state of person-to-person transmission. In Wapello County, we have worked amongst county officials and agencies to prepare plans to protect the citizens of Wapello County in all emergencies. As a response to COVID-19, county leaders have been diligently working around the clock to prepare and mitigate the effects of COVID-19 in our county. The Wapello County Healthcare Coalition has been working together for years to establish response plans for the health issues in our county. The coalition is made up of Wapello County representatives from emergency management, public health, Wapello Regional Health Center, long-term care facilities, clinics, dialysis, and EMS. To date, Wapello County Emergency Management has been working in conjunction with Wapello County Public Health to provide support for our community. On March 15, 2020, the Wapello County Emergency Operations Center was opened to begin centralized coordination and communications in support of public health. Tonight, you will hear from two panels of community leaders about what their agencies are doing to prepare for COVID-19 and what you can do to help them. We will begin with Mayor Lazio, followed by Supervisor Jerry Parker, Sheriff Don Phillips, and Police Chief Tom McAndrew. We'll then hear from a board that will consist of our healthcare representatives, Linnell Deers from Wapello County Public Health, Molly Layton from River Hills representing our clinics, Caitlin Lewis that will represent our long-term care, and Mr. Phil Knoll, the CEO of Wapello Regional Health Center. I would like to thank them for their participation and all the hard work that has gone into the response to keep citizens of the county safe. Before turning it over to our participants, I would like to take a moment to really emphasize that Wapello County residents look to trusted sources for information about COVID-19. Iowa Department of Public Health and the Centers for Disease Control are the county's trusted sources. In addition to these agencies, local information is available on the Wapello County Emergency Management website, wapelloready.org. There are a number of rumors floating around at this time, and according to the release from the Iowa Department of Homeland Security, the Iowa National Guard is not being deployed at this time. The governor is not ordering a 15-day shelter in place for residents at this time. There is not a recommendation of federal DHS to close businesses based on essential versus non-essential services. Again, let me emphasize to always look to trusted sources for your information. With that, I will turn it over to Mayor Lazio.
Thank you, Tim. Good evening. The steps we're taking today are about preparation, not panic. There's an extraordinary work being done alongside of our partners in the county and the state to keep Wapello safe, aware, and informed. Just as we've done in other emergencies like the flood of 2008, we're working together to secure available resources to help address the growing community needs in Wapello County around this global health crisis. Public officials are working around the clock to meet the needs for assistance and to ensure that the concerns of our residents are being fully addressed. I personally want to thank all the colleagues up here at the bench who are working together tonight. At this time, there are no confirmed cases in Wapello County, despite the rumors you may hear. But that does not mean we should not take action. Planning and preparedness are key requirements to a successful response in the event of an emergency. This is a make or break moment in the COVID-19 outbreak because we are really worried about the health threats to our lifetime, and certainly it's a new experience for all of us. Now is a time for strong, bold leadership from our elected officials. When we're in the midst of an emergency, community members turn to public officials with the expectation of immediate and decisive action to protect their well-being and safety. Wapello County local government, public health, emergency management, healthcare providers, long-term care providers, school, and local businesses are stepping up in this crisis. Local officials are working together to help procure supplies. Healthcare providers are establishing protocols to protect patients, staff, and the community public. Schools are finding creative ways to help students and families with food and to continue learning opportunities. Long-term care facilities have led the charge to protect our country's most vulnerable residents. Businesses are setting hours for elderly shoppers and defining protocols to protect workers and patrons. We know that this is a hardship and a significant amount of economic pressure that comes from this effort, particularly for service employees. Federal and state government officials are looking at ways to help give them and to help them out. We all are part of this to protect each other. This afternoon, Governor Reynolds indicated that the more we do now to protect our communities, the quicker we'll get through this. This is an opportunity for community members to step up and to help the effort to protect the health and safety of our community. If you are sick, stay home. And certainly, we encourage you to talk to your healthcare provider for assistance if you have any symptoms. Be thoughtful and careful about how we use our healthcare facilities and our dispatch centers. Be proactive. Keep distance from each other. We call that the social distance. Avoid large groups, more than 10 people. We have not seen a significant impact on the city at this point. It certainly is affecting us, but with the help and hard work of our city and county leaders, I think we'll be prepared to weather this storm. Thank you.
Well, the Board of Supervisors are monitoring this daily. To say that this is something that we may change, from day to day would not be adequate. We are changing things hour to hour and minute by minute. Today, the Board of Supervisors has directed that the Wapello County Courthouse, the secondary roads, our mental health facility, our motor vehicle facility, county conservation, the Gothic House, pretty much all of the buildings that are the property of the Board of Supervisors, that they were closed today starting at 4:30. What you should be assured of is that the services that you deserve are going to continue to be provided. They'll just be provided in a little bit different way. We've got the phone numbers listed on our websites. We've got procedures listed on the websites. We've got phone numbers on the doors of all of these buildings that you can call if you have questions. And we have people, our staff is not going home just because the facilities are closed. They're going to be there to answer your questions, provide service, mail things to you, anything like that. So we want to assure you that the services that you deserve are still going to be continued, just slightly different. Wapello County has developed a continuity of government plan. I'm sure that most of you know that if we had a flood or a tornado or a fire, we would still continue the services that we provide to you. We would just be doing those from a different place. Well, this is the opposite. Our facilities are there, but the people may not be. We don't know today if our auditor's office or our treasurer's office are going to be fully staffed tomorrow or whether they won't be. So we have a continuity of government plan that says, okay, if the auditor's office has to be closed, we're not going to close it. We have other departments that are going to step in, and we've got an order of control. They know who's in charge, and they'll know what service is going to be provided. So just because we have a shortage of people, even at secondary roads, where we have a bridge goes out or we have a washout with this rain, if the secondary roads people are not available, contractors are available, and they're going to be on the scene to take care of those emergencies. The important thing here is be patient. We didn't ask for this to happen, and you didn't. Our job as supervisors is not necessarily to take care of you when you're sick or when you think you have the virus or you wonder whether you have the virus or not. Our job is to provide the services to you, and that's what we're going to do. The thing to remember is if we overplan, and the things you hear all of us talking about today that we're doing and that we're changing, if we overplan and we do too much, so what? We just practiced a little bit for the next one. But the devastation is if we underplan if we don't think this is that big a deal, and so we're not going to start getting ready for it until we have to, well, when you have to, it's too late. I know everybody sitting at this table up here, and I can guarantee you, every one of those are thinking of the interest of the public right now. None of them are thinking of themselves. Their thoughts are, what can I do to make sure the public's interests are taken care of? Be sure, if any of those phone numbers, whether it's a supervisor, any of the elected officials, call. If you have a question about anything, call.
Thanks, Supervisor Parker, Mayor Lazio. The responsibility of the Wapello County Sheriff's Office is to keep our community safe. While implementing precautionary measures to safeguard the health of the public who rely on our service, the members of the department who respond to those calls, and also those working in the jail. The Wapello County Sheriff's Office has implemented temporary changes in an effort to reduce risk associated with COVID-19. We have begun a heightened screening process at the intake in the jail and are taking additional precautions to clean and sanitize the inside of the facility. We're working on protocols to screen our staff as they arrive at work, which was also implemented here this afternoon. The Wapello County Sheriff's Office has suspended all jail visitation until further notice, other than attorney visits. For the protection of both department staff at the Sheriff's Office and Ottumwa Police Department, we have limited the access to the Wapello County Law Center. Members of the public are encouraged to stop at the Sheriff's Office, or are encouraged to call the Sheriff's Office first before stopping in. The public doors will remain unlocked to gain access to the lobby area. From there, the doors to the jail visitation lobby area and administration offices will be locked. There are phones in the entry area at the law center that can be picked up, and you can make contact with dispatch, and then they will direct your calls where they need to go. Both the police department and the sheriff's office has those phones in place. If anyone from the public needs a copy of an accident report, incident report, they can contact the respective departments they need to get the report from, and a copy will be emailed, faxed, or mailed to you. We have been working on making the concealed weapons permits available online, which has been completed. You can go on to www.wapellocounty.org, go to County Sheriff, and you'll see a drop-down box for the weapons permits. All permits forms can be filled out at home and mailed into the Sheriff's Office. Along with that mailing is a colored copy of your identification, like your driver's license or ID, and a copy of your training or DD-214, and a check or money order. The prices of each will be available on the website. Forms are also available at the Iowa Department of Public Safety website. Sex offenders needing to comply with the offender registry should pick up the phone located in the lobby, and the administration office will take care of you. All deputies are still here to serve you and is still available 24/7. We are, however, encouraging them to take additional precautions to reduce the risk potential. This may include reports by telephone when circumstances allow. Deputies are being encouraged to maintain a distance of at least 6 feet or further when talking to anyone in the public when possible. We are strongly encouraging the community to remain calm and to follow the advice of the official sources such as the Wapello County Board of Supervisors, the City of Ottumwa, Wapello County Emergency Management, Wapello County Public Health, Iowa Department of Public Health, Centers for Disease Control, and the Governor's Office. Help us keep your county safe by practicing social distancing, limiting gatherings to 10 or less. We are constantly reevaluating measures based upon the recommendations from the Governor's Office and intend to return to full service as soon as it is reasonably safe. These changes enable us to provide services that are critical to keep the community safe. We're here and we will continue to be here for you.
Good evening. Though there are no known cases of COVID-19 in Ottumwa, The Ottumwa Police Department would like residents of Ottumwa to know we have been meeting with key leaders and our staff on a regular basis to prepare for and ensure the safety of Ottumwa residents during this time. I'd like to thank Sheriff Phillips. He has been meeting with us on a regular basis and putting all the measures into place that he just described. I think we're ahead of the game here. Our officers are still working hard to serve the residents of Ottumwa. At the Ottumwa Department, we are increasing our cleaning efforts and are encouraging our officers to wash their hands when they enter the building. Like Sheriff Phillips said, we are starting to screen our employees today. The police department is also encouraging officers to take additional precautions to reduce risk. As indicated by Sheriff Phillips, again, this may include taking reports by telephone when circumstances allow and maintaining a distance of at least 6 feet when talking to anyone in public whenever possible. Officers will attempt to glove when handling property and working crime scenes. For the public, fingerprinting will be suspended until further notice. If you're sick, only call 911 if it's an emergency. For non-emergencies, contact your local healthcare provider and follow their instructions. If you're worried about COVID-19, please do not call the Wapello County Dispatch Center. We're getting all kinds of calls and we really need to reduce those. Look to trusted sources like Iowa Department of Public Health or Centers for Disease Control for guidance. We also strongly encourage the community to remain calm and to follow the advice of official sources. This is a fluid, ever-changing situation, and we need patience and cooperation for everyone's overall safety. Please join us in following the precautions recommended by Governor Reynolds to stay home, social distance, and limit gatherings to people, groups of 10 or more, or less, so we can better protect the health and safety of our most vulnerable residents of the city of Ottumwa. Thank you.
Tim, I might mention the city staff did meet this afternoon with JBS, one of our largest employers, and Mr. Joe Mock, the general manager, did inform us that they are fully operational and want to continue to operate as they have been. They are taking extra efforts to be sure of the safety of their employees and doing a lot of extra cleaning. There's been a rumor floating around that there's a contamination, and that is not true. We've also had contact with John Deere, and they're doing the same kinds of things, monitoring employees and making sure the people that can work are working, and some are doing it by remote contact.
Well, that will take a pause and bring up our next group of panelists. All right, a little logistics there, folks, so thanks for hanging in with us. We'll resume with our healthcare panel, and to start us off is the Director of Wapello County Public Health, Linnell Diers.
There is an expanding global outbreak of the virus called novel coronavirus that causes a disease called COVID-19. While most cases are associated with travel, the Iowa Department of Public Health now confirms person-to-person spread in the state of Iowa. There are currently no known cases in Wapello County. Wapello County Public Health has been working closely with the Wapello County Healthcare Coalition, emergency management, and key city leaders to prepare for and mitigate the impact of COVID-19 should we have a case in Wapello County. We encourage our county communities to remain calm and strong. Urge you to follow the advice of Iowa Department of Public Health and recommendations of Governor Kim Reynolds. Stay home when you are sick. If you have a complaint of fever, cough, and difficulty breathing, call your healthcare provider's office before leaving your home. Limit movement in the community. Limit visitors and gatherings to 10 or less people. Know what additional measures those at high risk and who are vulnerable should take. This includes Wapello County residents over the age of 60. Implement personal protective measures. Stay home when sick. Wash your hands. Cover coughs and sneezes. Clean frequently touched surfaces. Consider a 2-week supply of prescription and over-the-counter medications, food and other essentials. Know how to get food delivered if possible. Establish ways to communicate with others, families, friends, and coworkers. If possible, establish plans to telework, what to do about childcare, how to adapt to cancellations of events.
Thank you, Linnell. Phil?
Thank you for the opportunity to provide this important community update. As the CEO for Ottumwa Regional, I'd like to take a few moments to share with you what we are doing to prepare for a potential COVID-19 in our community and what you can do to help keep our community and our healthcare workers safe. As it pertains to our hospital's preparedness to treat patients with COVID-19, we are continuing to work closely with all of the state and local agencies as well as national agencies, including the Centers of Disease Control and Prevention, CDC. We've been preparing for the potential COVID-19 in our community for a number of weeks. We are building upon a robust emergency preparedness operations plan, which we have put into place at this point in time. Out of an abundance of caution, we have implemented strict visitor restrictions that have limited entry points to our hospital to 2. Per CDC guidelines, everyone entering our hospital will be screened for respiratory symptoms and travel history every day. So it's not one where you'll have somebody coming in one time and that's it. Every day, our staff, visitors, and patients will be screened that are coming through our doors. In accordance with recent guidance, we have made a difficult and necessary decision to reschedule elective and non-urgent cases over 30 days when deemed clinically appropriate. That will change depending on the cycle of this virus, so we continue to monitor that daily. Patients whose appointments are being rescheduled are being notified at this time, and their procedures will be rescheduled as soon as feasible. I'd like to share some following important information on how you can help prevent the spread of the disease and what to do if you're experiencing some respiratory illness symptoms. Wash your hands. Cover coughs and sneezes. Do not touch your nose and eyes. Clean surfaces with disinfectant cleaners. If your symptoms are mild, stay at home and expect to see, unless you're seeking medical care. Treat symptoms as appropriate at home. Separate yourself, distance yourself from other people, and monitor your symptoms. If your symptoms get worse, seek prompt medical attention before visiting your healthcare provider. Please call ahead so they can take necessary precautions to keep others from being exposed. Again, our hospital is fully prepared with the appropriate plans to detect, protect, and respond. We stand ready to serve should you or your family need care. Again, thank you for the opportunity to provide this update, and we trust and for the trust that you put in Ottumwa Regional Health Center for your choice of health.
Thank you, Phil. Who is next? Caitlin?
Hello. The Iowa Department of Public Health has been very committed to taking critical steps to ensure long-term care facility residents are protected from communicable diseases, including coronavirus, also known as COVID-19. Because older adults and those with chronic medical conditions are at highest risk for serious complications from COVID-19, the Iowa Department of Public Health, IDPH, has encouraged long-term care facilities to align their practices with recent guidance issued by the Centers for Medicare and Medicaid Services, which limits non-essential visitors to long-term care facilities. Wapello County long-term care facilities have followed this recommendation and aggressively implemented measures in effort to protect our residents. At this time, all visitation is restricted, except for families with residents who are experiencing end of life. Visitation for end of life residents is also limited. Non-essential personnel are not allowed in long-term care facilities, and supply deliveries are being coordinated outside. Staff are screened before entering the building for work, and group activities for residents have been changed to individual activities in the resident rooms. We encourage families to reach out and stay in touch with their loved ones via video conferencing and telephone. Some families have parked outside and talked to their loved ones through windows, by the phone, different things that we're doing to keep our residents happy. We thank everyone for their continued support as we work to keep our elderly population healthy and safe. Please support us in doing your part to keep yourself healthy. Help us flatten the spread of COVID-19 to protect our most vulnerable citizens. Stay home when you're sick. Keep distance between yourself and others. Continue to wash your hands, cover your coughs, and clean surfaces. If we work together on this, the strong can protect the weak.
Thank you, Caitlin. Molly?
River Hills has been actively working with the Wapello County Healthcare Coalition to keep our community members safe during this COVID-19 outbreak. We would like to emphasize, as everyone has, that there are currently no cases in Wapello County, but we would like to urge our patients to follow the IDPH guidelines and community recommendations. River Hills Community Health Center in Ottumwa, Richland, Centerville, and Sigourney are still currently open for appointments. In an effort to limit possible exposure to COVID-19, dental appointments are limited to emergencies only. Well child visits in Ottumwa will be performed on our former Women's Health location across from the dental reception on the first floor. If your child has been scheduled for a sick visit, you will still be seen upstairs on the pediatric floor on the second floor. Well woman exams will be postponed until July. As of now, family planning will continue to do STD testing, sick or acute visits, and birth control prescriptions. Appointments will be scheduled for people who are ill. Well persons that needing appointments or checkups will not be scheduled until further notice. Our family practice clinics will be focusing their efforts primarily on acute care and emergency care. Well patients with chronic conditions will continue to be able to access medications. If their chronic conditions become problematic or uncontrollable, then an office visit will be scheduled. Please call the clinic so that we're able to speak with you and determine how best to meet your needs. We do have nurses available to help answer questions over the phone. Behavioral health will continue to see patients. Again, please call their office if you have questions. And effective today, the clinics will close at 5 o'clock, except for behavioral health, who will not change their hours. If you have an appointment at River Hills, staff are present at all entrances to take your temperature and ask screening questions before you enter the clinic. This includes all staff who are screened prior to going to work. We will be limiting the number of people coming in with you to your appointments. We are currently working on a way to deliver telehealth so that we can continue to provide care for you via computer and telehealth. Please watch our Facebook page and our web page for updates on that. If you're experiencing a fever, cough, difficulty breathing, please stay home, call the clinic, and let us help you with care recommendations or get you connected with a provider.
Thank you, Molly. We also wanted you to hear from the school district. They were not able to send a representative tonight, but I will read a statement from Superintendent Nicole Koiker on their behalf. The coronavirus is having a dramatic impact on the lives of our community, county, and state. Thinking back to the first of the year, it's hard to imagine where we are today as the world continues to fight the spread of this virus. District administrators have spent spring break week brainstorming, attending various area and statewide webinars and Zoom sessions, and developing plans to meet the needs of our diverse stakeholders. Some of those steps include we have implemented a coronavirus update center on our website that features regular updates and links to a variety of local, area, and state resources. We also continue to communicate with our families using our student information system and social media channels, and will continue to update families. throughout the school closure. We are hopeful that students will be back in class in April, but also must continue to plan should the governor decide to extend this further. Starting on Monday, Ottumwa Schools, in collaboration with the Ottumwa YMCA, Bridgeview Center, the Bridge Church, will offer breakfast, lunch, and dinner meals to students. We know that many of our students rely on school meals and want to ensure that those continue throughout this time. 12 locations have been established for grab-and-go delivery twice a day. We have already heard from parents that this is a needed option. We also have many staff that offer to help in any way they can. We are sure that many will assist in this effort as well. District curriculum leaders have spent this week learning about what can be done and determining the best method to serve our students. We know that not all families have internet access or a computer. Starting Monday, we will begin to share resources with our families who wish to continue their child's learning. Resources will be shared with families using several communication channels. And we hope that students will have some access to free community Wi-Fi in some locations. We continue to stress messaging from the Iowa Department of Public Health as well as CDC regarding the coronavirus. This will be ongoing throughout this difficult time. I want to thank the community for joining us tonight and listening to our panelists. We will plan on some regular updates to keep you up to date on the efforts going on behind the scenes to keep you all safe. And I'll remind you to stay tuned to your trusted local, state, and federal sources for information, and don't fall into the trap of believing in the rumors. We will keep you regularly updated, and please reach out with any questions. Thank you.